Hi there, and good morning, everybody, and welcome to today's Introduction to Medicare presentation. Thanks for being early and on time. And we're going to get started in maybe another 30 or 60 seconds, if that's okay. We're expecting, I think we were expecting about 20 participants today. So we'll give them a little bit of time to get logged in, get situated, but we'll make sure we get started without wasting too much time. And again, my name is Stephen Rubacaba, and I work in the Health Insurance Counseling and Advocacy Program. We're joined here today by my colleague Abe Wishnia, who is also a HICAP counselor educator here in Santa Clara County. And today's presentation, we're targeting folks that are new to Medicare. It's a whole new world once we exit either our group health plan or whatever health insurance we have into the Medicare world. It can be rather confusing, sometimes overwhelming. So we're going to introduce y'all to all the parts of Medicare, some of the various enrollment periods, timelines, and some of the options too. And by the way, while folks are still joining, I just wanted to let y'all know that today's presentation is being recorded. The slides that y'all are seeing here today, we're also going to be emailing this out. So we're going to email the recording. So in case you need to step away from your computer, in case your Wi-Fi gets a little spotty, your internet gets a little funky, we will be emailing this recording. It's going to be all transcribed, so y'all can even read it if you want to. We'll send you the PowerPoint slide deck. We're also going to be referencing and mentioning something we call a Medicare consumer guide here for Santa Clara County residents. We're going to be emailing that, and then maybe some various other HICAP and Medicare flyers and brochures. And with that being said, so what I see somebody exercising, which is fantastic, is the Q&A little feature inside Zoom. So once I pass this over to Abe, I am going to be keeping an eye on the chat and the Q&A features. So by all means, feel free to type out your questions in there should you have them, if you are afraid you might forget it. We are going to move through this presentation uninterrupted, just to kind of keep it moving. Otherwise, we can be here literally all day or at least half the day. But we'll be glad to open it up for an open question and answer forum towards the end. So we'd be delighted to also hear your questions. But in the meantime, you can feel free to use the chat and question and answer feature. HICAP here in Santa Clara County, we are housed out of the county's Area Agency on Aging, or we're known as Sourcewise across the community. So we're a private nonprofit organization, been in the community for decades, since the 70s. And we have a good amount of in-house or internal programs that we provide services here. And by the way, all of our services that you see, everything is free, nothing costs a dime. And instead of discussing great detail all of these programs that we programs and services that we provide, I'm going to also send you a Sourcewise community brochure, which lists in more detail what these programs entail. But to start off, we have an information and awareness team. It's a really good start for people that need help. Sometimes we need all kinds of help. We don't even really know what help we need. We might think we only need help paying for our PG&E bill. And after talking to the information team, we realize, we have some food insecurities. We need some food in the house. We need some grab bars inside the house for mom or grandma. So information team is super knowledgeable and friendly on all kinds of programs and resources within our county. We also have our own set of caseworkers or social workers helping folks out that maybe don't have all the mental faculties there to leverage all the programs that they might qualify for. So we do have our own social workers. We have the county's Meals on Wheels program, which is, it's a meal delivery service, essentially. So for folks here in the county who are maybe homebound, bedbound, unable to obtain groceries, we can send them a weekly supply of meals with the senior diet in mind, so low sugar, low sodium. We have a digital inclusion program trying to bridge the divide of technology. So we're sending out free tech to folks, signing them up for internet services if they need it, and we're training them on how to use it. So we have a variety of other programs here. Jumping on down is the Health Insurance Counseling and Advocacy Program, or HICAP. is what we're known as across California. And HICAP, well, we're a part of a much larger network all across the country. But let me start off by telling y'all what HICAP does not do, right? So we don't sell any insurance. We do not represent any insurance company or any agent, nothing like this. Our role and scope of work is pretty direct and to the point. Let's help folks understand the rules of Medicare. Let's help folks understand their rights in this Medicare system. And then let's unpack and share all of the options available to y'all without applying any pressure on what to join. We're not allowed to tell you what to decide on. You make your decision. We'll provide perhaps some of the best options for you, your health, and your finances, right? All of our services, again, are free. We provide, well, we do a lot of outreach type of services like this. We do them on Zoom. We do them in person. And same thing with our counseling. We provide one-on-one telephone counseling. We offer appointments that last at least 1 hour in time to make sure you're heard and make sure we understand your specific situation. So it's over the telephone we're providing this. We even provide it in a virtual capacity, kind of like what you're seeing now, and then definitely in person. And we've recently implemented a appointment hotline. We have folks answering that telephone, speak a bunch of languages. We also have counselors that speak a variety of languages here as well, okay? So definitely exercise, and you have friends, family, clients, neighbors that need Medicare help, have them call us. We'll definitely provide guidance. We're all across California, like I mentioned. This is the California HICAP phone number. It's an 800 number. And like I mentioned, we're all across the country. And we're known as, across the country, that is, as the State Health Insurance Assistance Program, or SHIP, which is ultimately managed by the Center for Medicare and Medicaid Services. So ultimately managed by the federal government, right? And if you have friends, family living outside of California, this website here will direct folks to their local SHIP program and office, right? Here in Santa Clara County, by the way, we've built relationships over the last few decades with all types of partners in the community. So we do these types of presentations and one-on-one counseling services out in the community, right? Because we want to be where folks are at. So we have partnerships at a lot of the local community centers, senior centers, public library systems, even some health centers like hospitals. So you can catch us providing one-on-one counseling and outreach at these various sites. And with all of that being said, I think I've carried on enough. I'm going to pass it on over to my colleague, Abe Wishnia, who, geez, I mean, Abe has been a counselor with us since, and I get this wrong because time is moving kind of fast and slow, but I believe over 7 years, maybe pushing up on the 8th year now. Abe is tremendously informative. I love the way Abe unpacks the complexities of Medicare in an easy way to digest. Okay, so let me go ahead and stop sharing my screen and pass it over to Abe. Abe, thank you very much for joining us here today. Appreciate you. Let me do this, and thanks for bearing with me. And we're going to do that.
There we go.
Thank you, sir.
Thank you, Stephen. And actually, yeah, it is just about 8 years. I think it's 8 years next month. You know, time flies when you're doing something good. I've been doing this as a volunteer, both as a counselor and as a presenter. And one of the reasons I got involved, the main reason I got involved in this, as I was turning 65 and having to make decisions about Medicare, I found it confusing. I like to think I'm a reasonably intelligent person, but Medicare is complicated. And so I called HICAP, talked to someone over the phone, and they got me to that aha point where I understood what I needed to do and how to make what I thought would be a smart decision in terms of how I structured my Medicare. And later, when I was looking for volunteer opportunities, I thought, wow, this is a great program. Why not do the same for others? And it really is. That's why I keep doing this, because I see how much the HICAP program does to help people like us as we confront all of the complexities of Medicare, from simple questions to sometimes some very complicated cases where we end up going into not just a counseling role, but an advocacy role to help people through this. So I will just say this, and then I'll dive into this. If you're looking for something to do as a volunteer, consider this program. It's very worthwhile. Now, with that, I'm going to share my screen here. Do this. Click that, and here we go. We're going to be talking about this introduction to Medicare, and here's what I'm going to be covering this morning. First, I'm going to talk about how you sign up for Medicare. I'll cover the premiums. I'll talk about the parts of Medicare, Part A, which is hospital insurance, Part B, which is medical insurance, Medigap, also known as Medicare Supplement Insurance, Part D, which is prescription drug coverage, and then the privatized alternative, Part C, which is also known as Medicare Advantage. I'll also talk a little bit about some frauds and scams that target people who are on Medicare. And of course, some constant reminders of how to get help and answers to your questions. So with that, let's dive in. First of all is, how do you enroll in Medicare? Enrolling in Part A and Part B. Well, if you're already receiving Social Security before the age of 65, they'll enroll you automatically. You'll get a card a month or two before you turn 65, and Social Security Administration will handle that. But a lot of people don't start collecting Social Security before age 65, and in that case, if you're not, the enrollment is not automatic. You have to take the initiative to enroll. And the way you do it is through the Social Security Administration. You can do it in person. You can do it on telephone. By telephone, you can do it online. And I will tell you, doing it online is the easiest way. Doing it by telephone is probably the most frustrating because of what sometimes very, very long wait times if you try to call Social Security. So my suggestion is, if you have, and if you're watching this webinar, you probably have the computer ability to enroll online, but you can also do it by mail and by fax if you still have access to a fax machine. Now, an important thing to remember is you do not have to be retired to enroll. And I'm going to talk a little bit more about this. If you're just turning 65, you have what is called an initial enrollment period. It's a 7-month window that centers on the month of your birthday. It's the 3 months before, the month you turn 65, and the 3 months after. And so if you enroll before you turn 65, then your coverage becomes effective on the first of the month that you turn 65. If you enroll that month, the coverage becomes effective the following month. And as you can see on this chart, you enroll any time after that, and your coverage starts the first of the following month through that 7-month window. But what if you're still working and you're covered by a workplace plan, either yours or your spouse's? Some people get misinformation, and we deal with this all the time in their workplace meetings, where someone well-meaning tells them that you're turning 65, you have to sign up for Medicare, and that's wrong. As long as you are covered by a workplace plan that's related to your employment or your spouse's employment, you can continue to stay with that coverage as long as you have it, or as long as you want to keep that. In that case, you get what is called a special enrollment period to enroll in Part B. And the special enrollment period has a couple of conditions. You have to be enrolled in an employer or a union group health plan, either your own or your spouse's. And that enrollment has to be due to active employment, not COBRA. COBRA does not count. Some people make the mistake of thinking, well, I'll just go on to COBRA and ride with that for a while. No, that can get you in trouble. Don't do that. You stay with it as long as you're covered if it's a result of active employment of yourself or your spouse. In that case, you can enroll pretty much any time while you're working or covered past age 65, and up to 8 months after that coverage ends, whichever happens first. Now, if the coverage ends, don't wait too long, because there are some inherent risks that come with that, which I'll talk about. But for the most part, you do have that choice. And when you do have it, if you wait, there's a special form that you'll see referenced. It's called a CMS L564 that Social Security will ask you about, that you download and get your employer to sign, that verifies that you have had continuous coverage. And that's an important thing to remember. So what if you miss your initial enrollment period or you miss the special enrollment period? Well, there's still one more opportunity each year. It's called the general enrollment period. It's the first quarter of the year. We're in it right now from January 1 through March 31. You can use that to sign up, and your coverage would begin the month after you sign up. However, if you wait too long, you get locked out of it, you miss that general enrollment period. Because if you miss this one, March 31st, then you have to wait all the way to the following January. And you run risking basically a whole year without coverage. And for that year, you will get hit with a late enrollment penalty. And that's a lifetime penalty. And it's not worth it. Stay on top of this. Don't let yourself miss your initial enrollment period, the special enrollment period, or as a last resort, the general enrollment period. So to summarize, you have an initial enrollment period, that's that 7-month window, centered on the month you turn 65. A special enrollment period, if you're still working or covered by a workplace or union plan due to your active employment. You can then enroll up to 8 months after that coverage ends, but don't wait that long. Do it right away. You don't want to be without coverage. And then, of course, as I mentioned, the general enrollment period, which is the first quarter of every year, and your coverage would begin the month after you sign up. Now, Medicare Part A, for most people, does not have a premium. It's covered by deductions that were taken from your paycheck during your working years. And as long as you earned 40 credits, that's 40 quarters or 10 years equivalent of working, your coverage is going to be free. So there's no downside when you turn 65 to signing up for Part A, because Part A is hospitalization coverage. I'll go into that in a moment, but it can act as secondary insurance if you're hospitalized for your workplace plan, and that can be good extra protection if you need it. But as I say, for most people, Part A is free. It also includes, we often have a situation, typically it's a woman who was a stay-at-home homemaker, took care of the family, the home, raised the kids while her husband worked. In a case like that, she would be covered under the credits earned by her husband's work. And so she would not have to worry about paying for a premium for Part A. Now, there are also people who, for whatever reasons, haven't earned those 40 credits. They can still get Part A, but they'll have to pay a premium. And oftentimes this is for people, we run into people who are immigrants who worked in their home country, but they've been in the United States long enough, but haven't earned the work credits here in the United States. They can still get Part A, but they would pay a premium, as you can see on the screen, depending on how many quarters they worked. Now, Part B also has a premium. Everybody pays this, and it changes every year. This year, the amount is $174.70 a month. Most people have it deducted from their if you're taking Social Security, Medicare will deduct it from your Social Security benefit. I urge you, if you're collecting Social Security, to have it done that way. Otherwise, you can set up a payment plan. They will bill you, but the best way to do it in that case is to have it taken from your checking account as an automatic deduction. Whatever happens, if you sign up for the billing option, which is the worst choice, don't miss a payment. Don't let it go into arrears, because if you do, they will cancel your Part B premium after a few months, and that leads to a whole lot of problems and complications. So have it taken out of your Social Security benefit. Now, people who have high incomes get hit with an extra Medicare Part B tax. They call the Part B premium a premium, but really it is a tax. And so they also have a high income tax. It's known as the Income Related Monthly Adjustment Amount, or IRMA. And as you can see by this chart, depending on what your income is, it's based on what they call modified adjusted gross income that you report on your tax return. And the modified adjusted gross income is the adjusted gross income with certain kinds of favored deductions added back in. So it can be higher than what you might actually be filing as adjusted gross income. And as you can see here, for a couple, it's a 2-year look back. So they're going to look at right now the tax return that you filed most recently was for your 2022 income that you filed last April. Now, presumably next month you're going to file a tax return for 2023 income. They will look at that, and in the following year then do an adjustment to this. It's complicated. It's a 2-year look back, but as you can see here, a couple that reported for 2022 a modified adjusted gross income of more than $206,000 had this amount added. Each individual would have that amount added to their monthly premium, bringing their total monthly Part B premium to these numbers here in this column. But it's a 2-year look back, and it can change every year. So if you had a one-time big income bump, maybe you got an inheritance, or you sold an investment property and it bumped your income for that one time, the following year, when your income goes back to its more normal flow, it will adjust again, and you might be able to avoid the IRMA. Well, while there's a tax on high earners, there are also programs for people who are very low income. And some of these programs can cover all of the costs of your Medicare premiums. If you're very low income, or this applies to you or someone, a member of your family or someone that you care about, make an appointment to talk to one of our counselors. We can explain how this works, help you understand whether you might qualify and how to apply for that kind of additional assistance. Now, let's talk about how Medicare is structured. There are basically 2 alternative forms of structuring your Medicare. It's what we call original Medicare, where you have Part A, Part B, you add a Medicare supplement plan and a prescription drug plan, or the privatized alternative, which is formerly known as Part C, but was given the marketing name of Medicare Advantage. And the Medicare Advantage plans, for the most part, you don't add a prescription drug plan because most of those include prescription drug coverage. I'm going to go through these to explain how they work and what the differences are, so you can have a better understanding of the choice that you'll make. So original Medicare, we call it original Medicare because this is the way it was originally structured. With that, you can go to any doctor, any practitioner, any hospital, any nursing home, any hospice agency, anywhere in the United States that accepts Medicare, and the vast majority do. The numbers fluctuate, but the most recent number I saw is that among doctors in the United States, it's somewhere north of 98% of the doctors accept original Medicare. Okay. Original Medicare was set up as a fee-for-service model, which means like any other business, you do business with them, they charge a fee for the service, you don't see them, they can't charge a fee, they don't get paid. You go to the doctor's office, doctor accepts Medicare, the doctor sees you, treats you, bills Medicare, Medicare pays the doctor. If the doctor doesn't see you, the doctor can't bill Medicare. That's straightforward. It's not an HMO. There are no networks with original Medicare. You can see any doctor anywhere in the country. You are not required to have an assigned primary care physician. You don't need a primary care physician's approval to see a specialist. It's not a PPO. There are no network restrictions of any kind. And since your coverage goes with you, so if you're on vacation visiting friends or family in another part of the country and you feel sick and you need to see a doctor, your Medicare coverage goes with you. And that's an important distinction between the Medicare Advantage model, which I'll explain in a minute. So the way original Medicare works, there's Part A, which is hospital insurance. It basically covers you when you're an inpatient. You're admitted, you're an inpatient, you're in the hospital for surgery, other kinds of treatments. It also covers skilled nursing care if that's something that is required as part of your rehabilitation. You've been in the hospital for surgery, but you're not quite ready to go home. You need some skilled nursing care that doesn't require full hospitalization. Medicare covers it during your rehab period. It would cover it for home health care under similar circumstances. And Part A also covers hospice care, which is defined as for someone with a terminal diagnosis with an expectation of 6 months or so to live. Now, Part A has deductibles and copays, and I'll get to those in a moment. Part B is outpatient care. That's when you go to a doctor's office or you go to a lab. You go to a doctor's office, doctor examines you, the doctor treats you. Doctor may say that she wants you to get x-rays or get a blood workup. Part B covers those. Part B covers certain kinds of preventive services, like flu shots. It covers an annual wellness exam or an annual wellness visit. It doesn't cover a traditional annual physical. That's a different kind of animal. But it covers home health care under certain circumstances. You've been injured, you need someone in the home to help you kind of during a rehab. Diagnostic tests, therapies, physical therapy if you need that, durable medical equipment like canes and crutches, those kinds of things. Those are all parts covered under Part B. And Part B has an annual deductible that again changes every year. This year it's $240. And Part B has a 20% copay. Now, here's the way this works. You go to the doctor's office and the doctor treats you, and let's say the doctor bills Medicare, and Medicare says the doctor is entitled to receive $500. I'm just pulling that number out of the air, but the Medicare says the doctor is entitled to $500 in compensation. Medicare doesn't send the doctor $500. Medicare says the doctor 80% of that, which in this example would be $400. And you as the patient are responsible for the other 20%, in this example, $100. So those can build up, and I'll talk about how people cover those copays in a minute. But there's some things you need to know that are not covered by Medicare under Part A or Part B. Medicare does not cover long-term care in a nursing home. Someone with dementia, for example, or someone has other needs to go into a nursing home long-term. Medicare does not cover that. Medicare does not cover routine dental care. And by routine dental, I'm talking about cleanings, fillings, dental x-rays, that kind of thing. It does cover dental repair if your mouth has been damaged in a car accident, and that's part of your treatment to recover from something else that is covered by Medicare, then it is covered. But routine, no. Doesn't cover routine vision, things like an exam for eyeglasses and contact lenses. It doesn't cover hearing aids, cosmetic surgery, or various other kinds of elective surgeries. And Medicare does not cover you when you're traveling outside the United States. Now, there are some Medigap plans and some Medicare Advantage plans that throw in a limited foreign travel benefit, but generally Medicare, you cannot count on it to cover you if you're traveling outside the United States or even on a cruise ship that is outside of US waters. Now, remember I talked about all of these deductibles and copays. Well, people get what is called a Medigap or a Medicare supplement insurance plan to cover those, to cover some up to all of those, depending on the plan that you choose. And here's the way these work. These are plans that are sold by private insurance companies, but they are regulated by the federal government. And they're designed to pay the gaps, the out-of-pocket costs. That's why they call them a Medigap. And there are 10 standardized versions of these things, but they did something that confuses a lot of people. We talk about Medicare Part A, Part B, Part C, Part D. They gave these plans the same letter names, plan letter designations. There are Plan A, Plan B, Plan C, Plan D, etc. They could have called them Roman numeral 1, Roman numeral 2, 3, something else. It's confusing, but don't let that confuse you. The plan letter names for the Medigap plans have nothing to do with the Medicare part names. They just have the same letter designations. However, you do have to have Medicare Part A and Part B. You have to be signed up for both in order to buy a Medigap plan. And this is an explanation of what they are. If you look at this chart, and incidentally, this chart will be in the handout that Stephen will email to everyone who's signed up for this thing after our session ends. But you will see a page like this, and the way you read this, on the left-hand side of your screen, you'll see the benefits, parts of Medicare, things that are covered that have various kinds of deductibles or co-pays. So, for example, you'll see that Part A hospital inpatient coinsurance, that there is inpatient deductibles and co-pays there. The Medicare 20%, et cetera. Part B. As you look across, you'll see these plans: A, B, D, G, K, L, M, N, C, F. And if there's a dot in the intersection, it means that category of plan covers that benefit. If there's not a dot, it means it doesn't cover it. So you'll see, for example, the plan A, the A category plan, only have dots in 4 intersections, the B and 5, etc. The only one that has a dot in all the intersections is a Plan F, but that's only available now to people who are Medicare eligible before 2020. For those who became Medicare eligible after that or about to turn 65, the plan with the most comprehensive coverage is the Plan G. It has dots in every intersection except the annual deductible. Congress changed the rules on that, wanted us all to have more skin in the game, and prohibited the Medigap plans from covering the Part B deductible. Now, in your handout, there will be our consumer guide, a section of pages that are in blue, and this is what the first page on that is going to look like. And you'll see that they list alphabetically on the left-hand side all of these different insurance company name by alphabetical order by their name, and they're like 4 pages of this. This is just the first page. Then you go along, you'll see age blocks, 5-year increments below age 65, 65, 70, 75, 80. We show them kind of to give you a sample. But here's what I want you to notice. These plans are sold by private insurance companies. They can all charge whatever they want. The only difference, for example, between one company's Plan G and another company's Plan G is the premium. And so even on this first page, look at the variance from the most expensive plan for Plan G at age 65 charges $227 a month. The least expensive plan, just on this page, $136 a month. And there's some similar gaps and a little bit higher priced plans further into this. But here's the thing that I tell people. If you're going to get a Plan G, every Plan G has identical coverage to any other Plan G. Some throw in a few little extra benefits, but as a practical matter, they're all identical. So if they're the same, if they work the same way, why pay more? Don't buy a plan just because you know like the name of the insurance company or if you're familiar with it. Pick the one that's going to do the best job of meeting your needs, and then buy the least expensive plan. And on this handout, you'll see contact information for these plans, their website and a phone number to call to get an exact quote, because these are sample quotes. Your quote, the quotes will vary by where you live and your age. So call them to get that quote. Excuse me. Now, to enroll in a Medigap plan, the best time to enroll is when you first sign up, during your initial enrollment period or during your special enrollment period. Because when you sign up when you're first eligible for Part B, they cannot ask you any questions about pre-existing conditions. They cannot screen you for that. So even if you've had something you've been treated for a long time, that won't affect your ability to enroll as long as you do it during your initial enrollment period or during your special enrollment period. However, after that, you can still apply anytime if you miss those, if you're enrolling later, but except for certain conditions, they can ask you about pre-existing conditions, and they can, as a result, deny you or charge you more. So that especially hits people who have a gap in their coverage, haven't signed up for it. Then it can become very difficult, if not financially impossible, to get a Medigap plan. Now, where it also hits a lot of people is when they decide to switch from Part C and go back to original Medicare. Sometimes they have problems getting a Medicare supplement plan unless certain conditions apply here in California. Most states they cannot. 3 states they can. California plus 3 other states they can under certain conditions. So let's go on to prescription drug coverage. When Medicare was originally created, there was no prescription drug coverage. People had to cover all those costs out of pocket. It got really expensive. So about 25 years ago now, they added a Part D for drugs. And you can buy separate prescription drug plans. Here in Santa Clara County, there are 22 different plans available. Again, they're government regulated under contracts with Medicare. And you can get one as long as you have Part A or Part B or both. You don't need it if you have other creditable, what they call creditable coverage, which means comparable in benefits to the Medicare coverage. An example of that might be someone who gets their prescription drug coverage through VA. And if they get that through the VA and they're happy with it, they don't have to get a Medicare prescription drug plan. And the reason I say have to is some people think that, well, I'm not taking any medications right now. Why should I buy a prescription drug plan? Well, first of all, you never know what's going to happen to you in the future if you might need it and suddenly need expensive drugs. But if you don't get it when you're first eligible, Medicare will hit you with a delayed enrollment penalty. That can get very expensive. I once counseled a man who, the time he was about 85, he'd never had to take any medications. Now, at age 85, he was starting to have some health problems. He needed expensive prescriptions, wanted to get a drug plan. I helped him find a drug plan, but the late enrollment penalty for all the time that he waited to get it added another $50 a month, about $50 a month, to his premium. That was per month for the rest of his life, because these late enrollment penalties are lifetime penalties. So, right now, and I'll show you in a moment, there are low-cost prescription drug plans. You get one of those as a placeholder to protect you in case something comes up. Now, as I say, we have 22 plans available here under Original Medicare. And of the Medicare Advantage plans, all but 4 of those include prescription drug coverage. But for the Medicare Advantage plans to get drugs, you have to have both Part A and Part B to take advantage of it. The premiums range from a low of 40 cents a month to a high of $188.40 a month. That 40-cent a month premium, if you're not taking any prescription drugs right now, sign up for that 40-cent a month plan. That way, if something happens, you've got coverage, and you'll be able to change plans later if that turns out to be not a good plan for you. Some people make the mistake of buying a higher premium plan because they think it must be better. No, a 40-cent a month plan is not necessarily any better or any worse than a $188.40 a month plan. It depends on your medications and your particular circumstances. Now, they can, as I say, they can charge whatever they want, and they have deductibles that range from a low of $0 to a high of $545. And their co-pays for their various prescription drugs are all over the place. It is complicated to know how to choose it. That's why we help people, and you can do this on your own. The Medicare.gov website has a plan finder. This is what the home screen on the Medicare website looks like right now. And you'll see in front of this woman, right down in front of her, it says Find Health and Drug Plans. And the green button that says Find Plans Now. You click that and it takes you to their plan finder that asks you questions, but basically gives you an opportunity to list all of your current prescription medications. And then using the Medicare database and the information that the drug plans are required to file, it will calculate for you the plan that will have the lowest total out-of-pocket cost for you for the year based on the combination of premiums and copays for that particular plan for your particular medications. They've really improved this plan finder quite a bit in the last couple of years. It's a lot easier to use. But if for some reason you find it overwhelming or a little bit difficult, make an appointment to talk to one of our counselors. We help people with this. We can do it for you, do it along with you, show you how to do it. We frequently do it during in-person sessions. And then you get to choose, it gives you the opportunity to choose the most cost-effective plan. And the Plan Finder lets you enroll in your drug plans online, which is far easier and far less time consuming to do online than it is by calling the drug plan. Enrolling online is the way to go with that because of all the information that the Plan Finder provides. Now, remember I talked to the income related monthly adjustment amount, IRMA. It also applies to your prescription drug plan. And in this right-hand column, you see how much would be added to your monthly prescription drug premium, depending on where you fall in this income list. This would be added to whatever your prescription drug premium is per month for that year. But likewise, there are programs, there's a program called Extra Help for low-income people that can lower or completely cover their Part D premium. And if this is something that you're concerned about or applies to someone you care about, again, make an appointment to talk to one of our counselors. We can help you understand this and get an idea of whether that's something you would qualify for and how to apply. Now, remember, I said there are two ways to structure your Medicare. There's original Medicare, and then there's the privatized portion called Medicare Part C, or was given the marketing name of Medicare Advantage. Whether it's an advantage is for some, not necessarily for others. It's something you have to decide for yourself, and I'll try to point out why. Excuse me while I take a sip here. Try to keep my throat a little bit clearer as I talk to you. Medicare Advantage, that's the marketing name given for Part C. These are plans offered by private insurance companies. The insurance companies sell the plans, they administer the plans, they determine the payment policies. It was an attempt by Congress to privatize Medicare under the philosophy that the private sector can do anything better and less expensively than the government can. So they created the system that lets insurance companies handle your Medicare coverage. Now, it does come with restrictions. Each of these plans has a geographic coverage area. Sometimes it's only one county, and you have to live in and get your care within their coverage area. They all have network restrictions. Most of them are the HMO model, the Health Maintenance Organization, where you have to get all of your care from their network of providers. The best known HMO example around here is Kaiser Permanente, where you have to see a Kaiser doctor, go to a Kaiser lab, get your care at a Kaiser facility. As the HMO model, most of them require you to be assigned a primary care physician first. Now, if you're thinking about a Medicare Advantage plan, but if you have a doctor that you're currently seeing and that you like and that you want to stay with, find out whether your doctor accepts the particular Medicare Advantage plan that you're considering, because if he doesn't, you will have to change doctors because you will only be able to see doctors who are in their network. Just yesterday, I had a phone counseling appointment with a woman who was seeing a cancer specialist at Stanford, and she wanted to go into a Medicare Advantage plan only to learn that her doctor does not accept that Medicare Advantage plan and that she would have to change doctors. So she's going to opt to stay with original Medicare because it's more important to her to continue the care with that cancer specialist. So again, you have to have the primary care doctor assigned. And before you can see a specialist, your primary care doctor is a gatekeeper. And the primary care physician has to give you permission and a referral to the specialist. Now, these plans have a variety of premiums. They're all over the place. They all set their own deductibles. They all set their own copays. They also, under Medicare rules, have to have a maximum out-of-pocket limit for the combination of hospital and medical costs, not including premiums. But remember, if you want to go outside their network, you have to pay out of pocket for the care. In network, you're covered. Out of network, you might not. So this earlier example, you go on a vacation, visiting friends or family in another part of the country, and you feel sick. Not an emergency. You just feel sick. You want to see a doctor. Chances are you're going to have to pay out of pocket. Unless it's an actual emergency and you get the prior approval, you're going to have to pay. And even if they do approve it, you'll pay first, then have to try to get reimbursed. And you cannot use a Medigap or a Medicare supplement plan to cover these costs. That's against the law. Now, the plans do offer some extra benefits. You see those advertised, especially each year during Medicare's open enrollment period. But those plans come with conditions attached. They're at the plan's discretion as to who gets them, who qualifies for them. And those plans, along with other benefits, are subject to what they call prior authorization requirements. Prior authorization means that, let's say your doctor or a specialist says you need a particular treatment. Let's say the doctor says you need a particular kind of surgery. They can't just schedule it. They first have to submit that to the insurance company, to the plan, for them to review and approve it. And someone at the insurance company, not necessarily a medical professional, makes a decision as to whether they're going to cover it, whether they think it's necessary for you, regardless of what the doctor says. There is an appeals process, but it can be lengthy and it can be very frustrating. In fact, and I'll get into a little bit more on some of the issues with prior authorization, but the plans here in Santa Clara County, the premiums range from a low of $0 per month to a high of $79 per month. The out-of-pocket maximum for their co-pays and deductibles, not counting premiums, range from a low of just under $300 to more than $8,000 a year. And they have deductibles from $0 to $545. And their co-pays, they have co-pays for the drugs that they set. And incidentally, the IRMA that I mentioned for Part B and for Part D, you don't escape it by getting into a Medicare Advantage plan. They hit you for that regardless of which way you structure your Medicare. Now, this year we have 55 different Medicare Advantage plans available here in Santa Clara County. Last year, it was more, a number of plans left the area, and that created problems for people. And one year to another, a plan might leave the area, or providers might decide they're no longer going to accept the plan. This year, Medicare beneficiaries in San Diego, one of the largest medical groups, decided they were going to stop taking Medicare Advantage plans, and it left about 30,000 patients in a situation of either to change doctors or to go back to original Medicare if they wanted to stay with that doctor, because those physicians were so frustrated with the prior authorization problems in Medicare Advantage that they decided they were going to stop taking Medicare Advantage plans. Likewise, the Mayo Clinic facilities, I think in Georgia and Florida, announced that they would stop taking any Medicare Advantage plans. So there are issues with this to be aware of. But here you have 55 plans to choose from. Some places only have one or two, depending on the size of the population of and the cities in that particular county. In the handout that you're going to get, there's a section that has all these green pages. And this is a sample of the first page of that. And what you'll see across, you have these columns, each one column after another in alphabetical order by the name of the insurance company. And you look down the column and you can see their star ratings, their premiums, their maximum out-of-pocket limits, the deductibles and co-pays that they have for the various services. And you have the contact information for them. And you can go along this and look through and get an idea of which plan that you want to do. And it will give you, there's a section that shows you which medical groups contract with those particular plans. Now, remember I said original Medicare was a fee-for-service model. See a doctor, the doctor submits a bill, the doctor gets paid. You don't see a doctor, the doctor doesn't submit a bill, the doctor doesn't get paid. Part C is what they call a capitated model. And what that means is these insurance companies negotiate a fixed monthly fee per member that they get from Medicare. It takes the money that's allocated to you under Part A and your Part B premiums, and along with an additional amount of money that they can use for marketing. And they get a fixed monthly fee per month per member. And essentially, Medicare takes those and they send those to the plan. And for that fixed monthly fee per month, they contract to provide all of your Medicare coverage. Now, the national average this year for that fixed monthly capitated amount is about $1,200. And so they, not counting premiums that they would collect from their members. So for $1,200 a month, that's what they get. If they only see you once a year, they get $1,200 a month. If they never see you, they get $1,200 a month on average. If you're someone with a lot of health conditions and you need to be seen more frequently, they still get the same amount. You need major surgery, they still only get $1,200 a month. They don't get any more than that. It's capitated. They have to make it work on that fixed monthly fee. And so they have to manage the cost somehow. The way they do that is with something called prior authorization. I mentioned that earlier, where you want certain kinds of therapies, you want certain kinds of treatments. Anything outside the ordinary goes to the insurance company for them to review and decide whether, yeah, I think, yeah, no, you don't need physical therapy yet. Maybe, just take, try the video, watch these videos and see if that helps you. So differences between original Medicare and Medicare Advantage. Prior authorization, which I just mentioned, is a very significant difference. Where you go for care. With Medicare Advantage, you're restricted to their network. Out of network, you go out of visit, nope, you're not going to be covered. So where you go for care, in network or the flexibility to go anywhere. Prior authorization. The premiums and out-of-pocket costs are very different. For someone who is very healthy, never sees a doctor, you might be able to save money by being in a Medicare Advantage plan, because some of those plans have a 0 monthly premium and a 0 deductible. And if your budget is very tight, I've worked with a lot of people who counseled a lot of people. If they can save that additional monthly payment every month, it can make a big difference in their ability to get by. So that's a significant potential benefit for some people. And some of these plans do offer, you see them advertise extra benefits. Some of them will offer an allowance for dental care, routine dental, within a certain defined dental network. Excuse me, I want to take a sip of within their dental network that they contract with. Some of them will provide a limited benefit for contact lenses or glasses. Some of them will provide a hearing aid benefit. Some of them will have coverage for certain over-the-counter medications that Medicare doesn't cover. And so, again, who can get these benefits is up to the plan, and those benefits are subject to prior authorization and certain rules that come with them. Now, one place where there is a genuine and meaningful benefit for some people is that the Medicare Advantage plans cannot deny anyone due to prior pre-existing conditions. So someone who goes into Medicare, you're sick for whatever reason, you've delayed the coverage, you're coming on late, you have serious pre-existing conditions, you are late in enrolling, you can't get a Medigap plan. The Medicare Advantage plans have to accept you. That's one of the things where there's a genuine benefit there. Now, they can save you money, as I said, when you're in good health, but they can be a problem for someone who has serious health conditions or people who are in the last years of life. As Medicare counselors, we regularly meet with people who have cancer or heart disease and want to see a specialist at Stanford, but that specialist is not in their network. In fact, Stanford only takes one, specialists only take one Medicare Advantage plan. Most of them, their plan will cover it. They want to see it. The plan says no. They want to see that specialist. They have to pay out of pocket whatever that cost is. And so in many cases, these people want to try to get out of Medicare Advantage and back to original Medicare and encounter problems. Now, among the reasons that they want to get out, now, this is from the Journal of Clinical Oncology. That's a professional publication for cancer doctors. I grabbed a couple pages from the first reports of a study that they did. The study was headlined, Medicare Advantage, a disadvantage for complex cancer surgery patients. And the researchers wanted to find out, how does Medicare Advantage treatment compare to traditional Medicare with respect to access and outcomes and cost of cancer care for complex cancer surgery? And they looked at the records of more than 76,000 Medicare beneficiaries, about equally divided between Medicare Advantage and traditional Medicare. What they found was those cancer patients who were in Medicare Advantage were less likely to be able to get their surgery at high volume hospitals. Those are hospitals that do a lot of those kinds of surgeries and presumably would have greater expertise in doing those surgeries. They were less likely to be able to get their surgeries at the higher volume hospitals, and they had a higher mortality rate in the first 30 days post-surgery for those complex cancers. Higher mortality rate compared to those in original Medicare. But the Medicare Advantage plans did incur lower costs. The Government Accountability Office wanted to look at, why is it that people who turned out to be in the last year or two of life tried to get out of Medicare Advantage and go back to original Medicare? And this is from their report. They said stakeholders told GAO, the Government Accountability Office, that among other reasons, beneficiaries in the last year of life may disenroll because of potential limitations accessing specialized care under Medicare Advantage. The Office of the Inspector General at the Department of Health and Human Services was looking into the growing number of complaints about Medicare Advantage plans denying prior authorizations for things Medicare is supposed to cover. And they issued this report. This is the headline in the opening paragraph of the report issued by the Office of Inspector General. It says, some Medicare Advantage organization denials of prior authorization requests raise concerns about beneficiary access to medically necessary care. Medicare Advantage organizations sometimes delayed or denied Medicare Advantage beneficiaries access to services, even though the requests met Medicare coverage rules. Denying requests that meet Medicare coverage rules may prevent or delay beneficiaries from receiving medically necessary care. The report also said a central concern about capitated payment models, including the model used in Medicare Advantage, is the potential incentive for insurers to deny access to services and payment in an attempt to increase profits. There are a lot of companies that are in the Medicare Advantage. Oh, well, before I go on to that one more that I almost forgot. Most recently, the issue has come up about how Medicare Advantage plans are using artificial intelligence algorithms to make the decisions to deny care, to cut seniors off from care despite what the doctors recommend. And this is from a publication called Stat News. That's a publication that targets healthcare industry, healthcare providers. Their study said a stat investigation found artificial intelligence is now driving their denials to new heights in Medicare Advantage. The denials that follow are setting off heated disputes between doctors and insurers, often delaying treatment of seriously ill patients who are neither aware of the algorithms nor able to question their calculations. And in fact, several of the biggest Medicare Advantage insurance companies now are facing class action suits by the families of patients who died as a result of their continuing treatment being stopped because the Medicare Advantage plan used artificial intelligence algorithms and would not continue the care, covering the care. No, I went back, clicked the wrong direction. Here we go, this way. Big insurance companies are in Medicare Advantage plans because Medicare Advantage plans, among other things, have the highest gross margins of any kind of health insurance. Now, gross margin is not the same as gross profit, but it's an indicator of the value of these plans and the premiums that they collect. And it's interesting, this is from the New York Times, that most of the large insurers, these are companies that provide Medicare Advantage plans, have been accused of fraud, either by whistleblowers or by the US government, or according to the Office of the Inspector General of HHS, have overbilled Medicare. And chances are, you know, all of these companies, they sell Medicare Advantage plans here. Just, you have to understand that there's a problem there. Now, before I go on with this, I have been accused in the Q&A, people ask me, it sounds like I'm biased against Medicare Advantage plans. I'm not, but as Medicare counselors, we see so many people who get into a Medicare Advantage plans and then want to get out of it because they don't understand some of the challenges that they're going to have. If you're going to go in for a Medicare Advantage plan, I just want you to do so with your eyes wide open so that you understand how these programs work, the kinds of situations you might be confronted with, so that you make a decision that, for whatever combination of reasons you have, is the best decision for your circumstances. Now, people do have opportunities to make some changes in their Medicare coverage. Each year, Medicare has an annual open enrollment period. It's also called an annual election period. And it's in the last quarter of the year, it runs from October 15 to December 7. And that's a time when you can move from one Medicare Advantage plan to another, move from original Medicare to Medicare Advantage, move from Medicare Advantage to original Medicare. You can change prescription drug plans. And these changes then would become effective the following January 1. However, for those people who are moving from Medicare Advantage to original Medicare, there's the issue of whether you're going to be able to get a Medigap or Medicare supplement plan. And you first have to make sure that you can do that, because otherwise, you know, you won't have any coverage for your deductibles and copays. And it can be very difficult for people to do. Now, here in California, California is one of only a handful of states that have something that they call a guaranteed issue right, that allows you to move from Medicare Advantage to original Medicare and get a Medigap plan as long as certain conditions are met by the Medicare Advantage plan. And those involve, this is under California code, California insurance code number. But if the Medicare Advantage plan raises premiums or eliminates a benefit, or they terminate a contract with your doctor, these are conditions that can trigger a guaranteed issue right to buy a Medigap plan without them asking about pre-existing conditions. However, it's complicated. And if you get to that point, and for those of you this would be new to Medicare, this would become in that period from October to December. If you decide you want to get out of one and you're hoping that there's a guaranteed issue right, make an appointment to talk to one of our counselors. We monitor this thing. We monitor the changes that they make and can help you understand whether you can do it and help you make that change if necessary. I had to work with a client, had to help him fight an insurance company to make a change like that when first they wouldn't believe that California guaranteed him that right. And we finally got him that Medigap plan that the insurance company tried to deny. The way you know if you want to make a change, all of the plans, the drug plans, the Medicare Advantage plans, are required to send out an annual notice of change. It comes in September every year. And it's they're required to show side by side any changes they're making in premiums, in benefits, and deductibles, and co-pays, providers, that kind of thing. And it will tell you if it's making a change that will affect you or that you might care about. And getting that notice of change then becomes your trigger to look at making a change if that's what you want to do. Too many people ignore these things, they throw them away. No, it's an important document. You should watch for it, and it gives you a basis for making some key decisions. So to review, where to enroll. If you want to enroll in a Medicare Advantage plan or in a prescription drug plan, you can contact the insurance company, go through Medicare, or the best way to do it is through the Medicare.gov website. And a reminder, use the Medicare.gov. Don't go to Medicare.com. Don't go to Medicare.org. Those are owned by insurance companies. Only Medicare.gov is the Medicare website. If you want to get a Medigap plan, you contact the insurance company, and you can get that either on the Medicare website or from the handout that Stephen will be sending you after this presentation. Now, I can't wrap this up without briefly talking about Medicare fraud and scams, because there are bad actors who will target you because you're 65 or older, because you're on Medicare. And one of the things that they're going to try to do is to get your Medicare number one way or another. The Medicare number used to be your Social Security number till they finally figured out that was a bad idea, leading people to identity theft. Now you do have a unique number, but you need to protect it anyway, because what bad actors can do, they can take your Medicare number, they get that, they have your name, your Medicare number, they can pretend to be doctors, submit a bill to Medicare claiming they have treated you for something, get paid by Medicare, and make off with that money. And Medicare loses about $60 billion a year to fraud, waste, and abuse. That's money that could be going to lowering our premiums, providing extra care. That's a lot of money. We all need to work together to help Medicare not help that money go to where it's supposed to go. Among the kinds of scams, one of them is a phone scam that targets people who are new to Medicare. Someone calls them up and says, "Hi, I'm from Medicare, and I want to just confirm that you got your new Medicare card." You say, "Yeah, good. Okay, now we need to activate that card so that you can use it. So let's do it. Okay, so let's confirm your name," and they get your date of birth and confirm the Medicare number. No, it's a scam. Medicare will never call you. You do not need to activate your card. There is no fee to activate a card. If anyone ever calls you saying they need your Medicare number, hang up. It's most likely a scam. Medicare, if they want to contact you, they will do it by regular US mail. They will not call you on the telephone for something like that. One of these scams that's out there is a genetic testing scam. You might get it at a community health fair. Someone might have a little table set up and offering free genetic testing through Medicare. And all they need is your Medicare number. They'll take a picture of your Medicare card. They'll give you a swab kit and tell you to send that off. Guess what? Medicare does not cover routine genetic testing. Medicare only covers genetic tests if your doctor feels that they need it to confirm a particular diagnosis and treatment plan for you. Otherwise, Medicare won't cover it. But those scammers now will have your name, your date of birth, your Medicare number, and boom, money is gone from the Medicare program. There are a number of others, but just keep in mind, protect your Medicare number. If anyone ever offers you something free through Medicare, hang up, turn off that TV commercial, do something, go the other way, because it's going to be a scam. So how do you get the appointments? Your source of information. I'm going to leave this slide up, but that's a phone number that Stephen mentioned to make appointments. We have counselors who speak multiple languages. We have appointments by telephone, in person, or via video chat, any of those, whatever work for you. So with that, I'm going to turn it back to Stephen. We will open it up for Q&A, and we'll stay here as long as you have questions.
Well, I'd just like to say thank you, Abe, for unpacking this information for us. I mean, thank you to all of the audience members and attendees for joining us today. Thanks for being patient with us this morning. I mean, I know it's a lot of information to absorb and digest. So I hope this was a decent introduction of, and hopefully y'all learned something that you didn't know coming into this session. And one other takeaway I want to remind you is leverage our services. You know, we're all around the county. We have counselors speak a variety of languages. Services are free, objective, and unbiased. We're just trying to help folks. And I'm going to stop this recording, and then we're going to open it up for question and answers. Thank you all.